Hi everyone, it's Dr. Giles here with Aspire Chiropractic. I wanted to get on a video today and explain to you guys a little bit about frozen shoulder. It's a condition I've been seeing with a few patients in my office. It's a little tricky to understand, and I want you to also know that a chiropractor is the best person you could be seeing for getting treatment for it. First off, let's understand the shoulder and the anatomy. It's essentially made up of three structures: the humerus or the shoulder bone, our clavicle, which is our collarbone, and our scapula, the shoulder blade. And holding all of these structures together is a strong and sturdy connective tissue we call the joint capsule. And inside of that joint capsule is a lining of something called synovial fluid. That helps make the motion in the shoulder smooth and easy. Now, in frozen shoulder, what happens is there's a chronic use of the shoulder joint, whether that means you're sitting at a computer all day with your shoulders forward, typing and using the mouse, or just a general lack of activity. But these tissue inside of the joint, they start to get rigid and scar tissue forms, and essentially the shoulder becomes frozen in place. Now, there's three stages to it. First stage being the freezing stage. And according to the literature, this can be about 4 to 6 months, and it's characterized by having severe pain in the shoulder when you're trying to use it. There's a mild to moderate limit in the range of motion, but mostly characterized by pain. The second stage, which was the one that we see most often and we're treating, is the frozen stage. This is about at 12 months, and there's a decrease in the pain, but a much further decrease in the range of motion in the shoulder. Patients usually can't get it much past this point, and when they are, you'll notice that they're shrugging their shoulder up to try and get it higher and higher. And then essentially there's a third stage called the thawing stage, which it seems that if given enough time, the joint will sort of relieve itself and start to improve. Now, I've treated a few frozen shoulders, and I've never actually seen anybody get to this point because by the time they're coming into the office, it's bad enough that they want to start doing something about it. And I told you how a chiropractor is the best person you could be seeing for it. Well, that's because as chiropractors, we're trained to mobilize the joints. Everyone knows we treat and mobilize the neck and the back, but we're also trained in doing the ankles, the knees, the hips, the shoulders, and the elbow. So in our office, we'll do consistent, regular adjustments to the shoulder to break up those adhesions in the capsule and start getting you a lot more range of motion. So if you think you could be dealing with something like frozen shoulder, or maybe you know somebody that's dealing with frozen shoulder, come on into Aspire Chiropractic. We're ready to help you when you're ready to be your best, naturally.